Did you know up to 24 million people of all ages and genders suffer from an eating disorder in the U.S.? Jim Greenblatt, Chief Medical Officer of Walden Behavioral Care and author of a new book, Answers to Appetite Control, talks about the different questions that people have about eating disorders and the correlation between the two. Thank you so much, Jim, for joining me.
My pleasure.
Today. Now, I got that stat and other stats as well from a website called the National Association of Anorexia Nervosa and Associated Disorders. And they were also saying about 50% of people with eating disorders also meet the criteria for depression. And you talk about this in your book as well, too, where both are very closely related.
Yeah, there's some research that actually goes as high as 80%. So the vast majority of are women and some men that struggle with eating disorders also have other psychiatric illnesses like depression being the most common, but also anxiety, substance abuse, and attention deficit hyperactivity disorder.
Now, you've written books about this before. Your first book was on anorexia. This book is on binge eating and bulimia. It seems like this is a pretty important topic that needs to be discussed that I feel as if perhaps is not as talked about enough as it should be. Are you trying to change that?
Well, we're hoping binge eating disorder, which is the most prevalent eating disorder, with a very high correlation with obesity, which is a growing epidemic for kids and adults, obviously. But up until last year, there wasn't even an official diagnosis of binge eating disorder. So only in the past year has the American Psychiatric Association defined binge eating as a disorder that needs to be treated and covered by our health insurance now.
What if somebody is struggling to understand why they're dealing with anorexia or bulimia or an eating disorder? What's the best advice you can give them?
Well, I think the most important message that I share with patients is that everyone is different. So there are lots of paths to disordered eating. Some of it clearly stress and psychological, many of it physiological, nutritional deficiencies, and again, oftentimes other psychiatric illnesses. So getting a professional evaluation for someone who knows eating disorders is probably the most important thing I can share.
Now, this website also had other interesting stats. Eating disorders, they say, have the highest mortality rate of any psychiatric illness, but it's not just highest mortality rates.
It's a statistic that I didn't know for many years as a practicing psychiatrist. Most people don't. That the highest mortality rate of any psychiatric illness, depression, bipolar illness, or substance abuse, more people, the rate is higher. And what's more striking is the risk of suicide is higher. So the highest cause of death for patients with eating disorders is suicide.
That's incredible. And it's sadly starting off at a much younger age. I mean, even girls, they had a poll out, I can't remember the details of it, but girls even as young as 8 and 10 years old were saying one of their worst fears in life was being fat. And you think at 8 years old, these girls are concerned about being fat.
And not only are these girls, middle school students, worrying about their weight, they're actually needing treatment and hospitalization because they restrict their intake because of these worries. And we're seeing them in the hospital now. So between 8 and 12 years of age, we're seeing serious eating disorder thinking.
Why is this happening to our younger ones now? Is it just we're more aware that it's happening? Has it always been this way? Or is it new pressures, social pressures because of social media? I mean, what is the reason that it's hitting our younger kids?
Well, I think it's all the above. I mean, clearly the pressure to be thin and perfect is part of what our culture dictates. And then the kind of foods that we're feeding our kids, which are oftentimes devoid of nutrients, I think sets up an eating disorder as well. So the kind of lack of healthy eating, the cultural influences, as well as many of these young children have a disorder called obsessive compulsive disorder. So they worry a lot. And rather than worrying about germs or other kinds of things, they're worrying about their weight. And oftentimes that is what we call a coexistent problem.
Now, when you were writing your book, Answers to Appetite Control, what was some research you found that kind of actually surprised you, that was or new to you, that you were like, wow, I didn't think of that before, that you wanted to bring to the public?
I think the most important thing that I've seen over and over again is how debilitating binge eating disorder can be. Because these are individuals that have been on the kind of yo-yo dieting, they keep trying, and they can't stop. And the core part of the book is looking at the biochemistry of the brain. And binge eating and appetite is actually a reflection of a biochemistry that's gone awry. And so what we try to do is take away the shame and the guilt for patients who just can't stop it on their own and develop a treatment program, be it nutritional supplements and or medicines and or therapy to help them gain that control of their appetite.
Wow. Now, I love to ask questions on social media, and when I had mentioned that I was going to be interviewing you about eating disorders and your book, I had received two different questions. One was a gentleman that had said, I appear to be in very normal health. He was a slim gentleman. He's like, but he loves eating junk food. Should he be concerned about the fact that maybe one day this could turn into an eating disorder where now he can eat basically anything he wants whenever he wants, but maybe eventually one day that'll catch up to him?
Not necessarily. One of the other important things that people don't realize is there's a very high genetic liability to eating disorders. So there's usually someone in the family that has an eating disorder. And eating junk food might not be good for their health in many reasons, but it does not predict a development of an eating disorder.
Okay. Now, a female viewer had asked, when you look at society standards of what somebody looks for or purports to be healthy, thin woman, like you had mentioned earlier, the standard of society, as opposed to somebody who may be overweight but eats healthily and exercises, there seems to be a disconnect there. How do you?
Well, so much of it is that cultural pressure and what we ask women to look like and be. But the most important thing that we see, regardless of weight, is women that are tortured by their thoughts. So whether they're underweight or overweight, the women that are tortured by what they eat, how they eat, and use behaviors, whether it's compulsive exercising or purging, to get rid of food because they worry about fat, that's the disordered eating. So it doesn't have to do with weight on the scale. It has to do with the thought processes associated with the food.
All right, well, thank you so much, Jim Greenblatt from Answers to Appetite Control. Thank you for your time.
Appreciate your help.